Today I shall be talking about congenital caliphus equinovarus. This is also called clubfoot. Congenital means it is present since birth. Pes means foot. Caliphus, we can also remember that talus is involved. Equinovarus is the deformity. This is the most common congenital anomaly in Asian countries. This is more common in males, usually first child. More commonly, this is bilateral. Talking about causes, most commonly it is idiopathic, cause is unknown. Secondary clubfoot. This can be associated with other diseases like neural tube defects. Meningocele, meningomyelocele. It is also associated with hip abnormalities like developmental dysplasia of hip. Arthrogyroposis multiplex congenita. Freeman-Sheldon syndrome. Now the deformities seen in this. We have mnemonics for this. @cave. C for cavus. A for adduction. V for varus, means inversion. E for equinus. In cavus, there is increase in medial longitudinal arch at midfoot. What does this mean? Normally, the foot is like this. But in cavus, this is ground. Foot becomes like this. Increase in medial longitudinal arch at midfoot. In adduction, forefoot adduction at meta tarsometatarsal junction. Normally, the foot is like this, but in adduction, the foot becomes like this. In inversion, hind foot is rotated inward at talonavicular joint. Normally, the foot is like this, but in varus, foot becomes like this. Hind foot is rotated inward at talonavicular joint. In equinus, foot is fixed at plantar flexion at ankle joint. Suppose this is foot, then this is plantar flexion and this is dorsiflexion. So this is fixed at plantar flexion. This is, suppose this is normal foot. In equinus, the foot becomes like this. Heel is above the ground. So these are the deformities seen in the congenital talipus, equinovarus, cavus, adduction, varus and equinus. Talking about diagnosis, in antenatal, at 24 weeks of intrauterine life, we can perform ultrasonography and we can also do amniocentesis to see association of other congenital anomaly. At birth, we see the, and at birth there will be inability to approximate dorsum of feet with anterior aspect of leg. Suppose this is anterior aspect of the leg and this is dorsum of foot. Then this will be approximated normally, but in Clubfoot, this will be anterior aspect of the foot and foot will be like this. So it will not approximate. We also see the kite's angle. This is the angle formed between talocalcaneal angle. Normally it is 20 to 40 degrees, but in Clubfoot the angle becomes parallel or decreased. Now talking about the treatment. conservative management of CTEV. We have two methods, Kite's method and Ponseti method. This was used earlier. This is used now. At birth, in Kite's method, there is manipulation by mother. In initial weeks. In this manipulation and cast by surgeon. Change of cast in 2 weeks, every 2 weeks. In this change of cast is weekly. Fulcrum for manipulation. Calcaneo-cuboid joint. And this is and in this fulcrum for manipulation is head of talus. Correction order. The deformity was cavus, adduction, varus and equinus. So in Kite's method, CAVE. Firstly cavus is corrected, then adduction, then varus, then equinus. But in Ponseti method, firstly cavus is corrected, then equinus and varus is corrected simultaneously, and at last equinus is corrected. If this pattern is not followed, then it causes rocker bottom deformity. In this, correction occurs at mid-tarsal joint instead of head of talus. Duration of treatment. 6 to 9. It takes 6 to 9 months, and in this 6 to 8 weeks. After achieving correction with Ponseti method, we have to maintain the foot. For maintenance, we use Dennis Brown splint for 1 year. After 1 year, when the child starts walking, we use CTEV shoes in daytime and Dennis Brown splint in at night time. For up to 7 years of duration, up to 7 years. Because after 7 years, there is no recurrence of CTEV. In CTEV shoes, there is outer shoe raised, straight medial border, and there is no heel. This is for the correction of equinus. Pirani score is used for effectiveness of Ponseti method. Now, if recurrence occurs or conservative management fails, then we have to go to surgical treatment. If the child is of 1 to 3 years, then we have to perform posterior medial soft tissue release. Which is called turquoise operation. And if the child is of 3 to 8 years, then we have to perform osteotomy. Suppose this is the feet of the child, then we have to cut this bone. Then this will be empty space. Then we have to move in this way and correct the deformity. For this, the operation names are Lichtblau, operation. If the patient is of more than 10 years of the age, then we have to perform arthrodesis. As the name is triple, then in this we have to fix 3 joints: talonavicular, talocalcaneal, calcaneocuboid. This is all for Clubfoot. Thank you.